Hi everyone, welcome to my channel PharmD and Me. Today I want to answer a question that I frequently get, and that is, what is the difference between a pharmacy residency and a pharmacy fellowship? So I'm just going to jump right into it. The American Society of Health System Pharmacists, ASHP, defines a residency as an organized, directed postgraduate training program in a defined area of pharmacy practice. And they define a fellowship as a directed, highly individualized postgraduate program designed to prepare the participant to become an independent researcher. In summary, a residency and a fellowship are both postgraduate programs, which means that they're programs that are intended to be completed after the graduate program, which would be the PharmD. And they are both designed to prepare a person, a recent pharmacy graduate, towards their area of interest. However, there are some differences between these two programs. So how would you know which one to pursue? The main difference is that a pharmacy residency leans more towards the clinical aspect and a fellowship is more heavy on research. However, this does not mean that if you pursue a residency, you won't be doing research. And it does not mean that if you pursue a fellowship, you won't be doing things that directly impact the patient care process. Let's talk a little bit about residencies first. Traditionally, there's 2 years of residency, a PGY1 and PGY2. The first year, known as PGY1, is designed to get an overall view of the pharmacy world. During this year, the participant is going to have multiple rotations in different areas, in different aspects of the pharmacy profession. And by the end of it, they will be PGY1 certified, which basically means that they have a lot of clinical knowledge in various areas of pharmacy. Second year of residency is going to be more exposed to that specific area of interest that they want to be specialized in. Some of these areas are oncology, cardiology, infectious disease, pediatrics, and a lot others. However, some institutions will have a PGY1 that is more directed towards one of those specific areas because they specialize in those areas in particular. For example, some institutions specialize in pediatrics, others specialize in psychiatric care. And if you go for a PGY1 residency in one of these institutions, you might be more clinically knowledgeable in those areas. Like I mentioned before, a lot of the experiences that the resident is going to go through are very clinically oriented. So the resident is going to be interacting a lot with patients, they're going to be verifying medications, they're probably going to be staffing in the hospital, and they might also be expected to do some research. Now let's switch gears and let's talk about fellowships. While residencies are usually completed at a hospital or healthcare center, fellowships are usually obtained through a pharmaceutical company or a school. However, fellowships aren't always directed towards becoming a researcher. Some fellowships are also very heavy on leadership and organization management. And even though fellowships are sometimes similar to residencies in the sense that they're going to go through a series of rotations to learn more and expand their knowledge, sometimes a fellowship can be more static and based on the initiatives that the participant is working on. Some areas that a pharmacist is capable of working at after completing a fellowship are drug development, research, organization management. You can become a medical science liaison, education, pharmacovigilance, and many other areas that surround the pharmaceutical industry world. Hopefully this video helped you clarify the differences between a pharmacy residency and a pharmacy fellowship, and I also hope that you found it valuable. If you're still not sure whether you want to pursue a residency or a fellowship, stop to think where you envision yourself in the future. What are the things you enjoy? What are the things you're passionate about? Are you passionate about patient care, direct patient care? Do you want to be verifying medications and directly taking care of patients? Or do you see yourself in a different environment in which there's not a lot of patient interaction, maybe even none, but you're still making an impact on patient care by developing educational material, doing research that will contribute to the patient care process, doing research that leads to the development of new drugs? Do you see yourself as a professor or as a preceptor yourself? All of these are things that you have to think through before making a decision whether to pursue a residency or a fellowship. I also want to make it clear that residencies and fellowships are not the only ways to go after you graduate from pharmacy school. There are many other traditional and non-traditional paths through which you can go to achieve your goals. So I would say that the most important thing is to make the right connections, to do your own research, and to stay focused on what it is that you want to achieve in the future. I hope you enjoyed this video, and if you did, it will mean the world to me if you let me know in the comments. And if you liked the video, you can also subscribe and expect to see more videos like this. I will be talking about a lot of topics in the pharmacy world and sharing my own experiences as well. Also, leave any suggestions of topics that you would like for me to talk about. Thanks for watching!